1.
First aid is emergency medical care for someone who has been hurt or who is sick. The Good Samaritan Law, a law that gives legal protection to people who give reasonable assistance to those who are injured or ill. Duty to rescue. So it's a law that helps to protect citizens from helping others that they may see injured in public. Identify what's wrong, the 3 C's. Check, call, care, and in that order. You want to check out the situation. Make sure you're safe. First thing you should always do. So survey the scene. Check for injuries. Do a head-to-toe survey. And check the individual or injured person for medical alert jewelry. Call for help. Call 911. And care for the victim. How quickly a person gets help determines his or her fate. Check. Do they have a pulse? Are they breathing? Medical alert jewelry. This is a type of jewelry that someone may wear if they have diabetes, asthma, a heart condition, or maybe dementia. You can look for these things on their wrist and it will let you know. Like this one, for example, says, I am a family caregiver. This one says, Mother Kate has dementia, will need help. Call 216-202-8234. Those are some things you may see on somebody that you may have to care for in public. Personal protective equipment. These are things that you may need to wear when you're caring for an injured person. You may not have all of these things on you, but some medical professionals should have them on them or will. A breathing mask is one. Sterile gloves is another, and safety goggles is another item. It'll help prevent fluids like blood getting into your eyes. Call for help. When arriving to an emergency situation, call 911 and send someone to get the AED, which is an automated external defibrillator. Explain the best you can the name, location, and type of emergency to the 911 emergency operator. AED, once again, is an automated external defibrillator. You may see some of these located around your building. The one you may see in school is the one in the middle, this white case here. They are the best way to help save a life. Making an emergency phone call. What you need to do. Always stay calm. Make sure you are safe. Answer all the operator's questions as best you can. Follow the operator's instructions. Stay on the line until the operator tells you to hang up. Some things that you may need to say. 3 things that you need to say is your name, location where you are because you may not be at home, and type of emergency. You may have an emergency or experience an emergency when you're out shopping at the mall, when you're out the outlets at Riverhead, if you go to Splish Splash, an amusement park. So that would be your location. The condition of the victim if someone is hurt. The medical history of the victim if known. If you don't know and they're a stranger, you can also look for medical alert jewelry. That may give you some background information. And what you've done already to help the victim. Bleeding. There are 2 different kinds of bleeding wounds. There's a minor bleed or a major bleed. Minor bleeds are small, like scrapes or bruises. All you need to do is wash with mild soap and water. Apply an antibacterial cream like Neosporin or bacitracin and a sterile bandage. Major bleeding are major bleeds that bleed a lot or won't stop bleeding, like a deep puncture. You should apply direct pressure with a sterile gauze and hand using sterile gloves. Don't remove the bandage if the blood comes through. You just would add more and keep adding more if the blood continues to seep through the bandage. Elevate the wound above the heart if possible and go to the emergency room or call 911. This is an example of a minor bleed on the left, and a major bleeding example is on the right. And you can see how she's wearing gloves and she has a sterile gauze bandage. She's applying direct pressure with her hand and it's elevated above his heart. Poisons. Many household products can cause poisoning, such as cleaning products, automobile fluids, and medicines. Poisons can enter the body through your stomach, lungs, and skin. Think of some poisons that you may have in your household. Think of your garage. Think of your medicine cabinet. Think of cleaning supplies. 1. Find out what the poison is. So always identify the poison first. If the person is awake, ask them what they ate, drank, or breathed in. Look for nearby bottles or boxes for some clues. And smell. Use your senses. Aromas and a person's appearance may give you some clues as to what they may have ingested. You can call Poison Control at 1-800-222-1222. However, if it's an emergency situation and somebody is not breathing and their heart is stopped, call 911. Shock. Shock is the body's response to reduced blood flow due to an injury. When this happens, the body's cells don't get enough oxygen. Shock can cause death even if a person's injuries are not very serious. For this reason, a person in shock needs first aid right away. Signs and symptoms of shock. Person may feel lightheaded. Skin will be pale, cool, and clammy. Shivering may occur. Nausea or vomiting may occur. Heart rate is weak but rapid, and they may be confused. If a person is in shock, you should keep the person lying down flat on their back. Their feet should be elevated. If the victim has trouble breathing or has chest pain, do not raise their feet. Instead, raise the head and shoulders. Cover lightly with a coat or blanket. Only one. This will keep the body from losing heat. This is an example of the position a person in shock should be in. And you can do this for anyone. So anytime you're applying first aid to somebody, always treat for shock. Fractures and dislocations. Fracture is a broken or cracked bone. You can see the example in the picture here. Number 2, a dislocation, is when a bone is forced out of its normal position in the joint over here. So your shoulder here, the clavicle, may look crooked or higher than the opposite side, and it will be very painful. Types of bone fractures. There are many different types of bone fractures, as you can see in the slide. The one in the middle is a displaced compound fracture. The bone actually comes out of the skin. It's very, very severe. Fractures and dislocations. Treatment. Do not move the injured area, as this can make the injury worse. Try to keep the joints around the injury from moving. A splint may be used for this. And that's an example of a splint that will immobilize the joint. Burns. You have 3 layers of skin, which are called the epidermis, the first layer, the dermis, the second layer, and the hypodermis, the deep layer, or the third layer. First degree burn would be, an example would be a sunburn. Your skin is red or pink. A second degree burn will be red or pink with a blister. And a third degree burn may be leathery-like and white and charcoal-like. It can go all the way deep down, as you can see here, into the third layer of skin. It may burn the nerves away, and you may even see some bone. First degree burn, skin is pink. Treat with cold water and apply an antibiotic cream. Do not put ice on the skin. Second degree burn affects 2 layers of skin, will usually produce blisters. Treat with a cold water and a compress. If the burn is larger than 2 inches, that's in diameter, go to the ER or see a doctor. Do not pull off clothing that is stuck to the skin or the burn. Third degree burn affects all layers of the skin and possibly muscle and bone. Skin is charred and black or dry white, it's like leathery looking. It might not hurt much because of damage to the nerves. Their pain sensors are damaged or destroyed, so you may not have any sense of feeling. You want to treat, call for help immediately, 911, apply a sterile wet cloth, and treat for shock. Someone who has this type of burn can get an infection easy. What do you do if you're choking? If somebody is choking, there is the universal sign of choking. So the 2 hands will be around the neck, just like in this picture, and that's what you should do. If you are choking, or if you see somebody using this sign, you will know that they are choking. How can you help? You can administer the Heimlich maneuver. If a person can cough or speak, encourage them to cough first. If you hear nothing, you will need to administer the Heimlich maneuver. Note, you want to stand or kneel behind him or her and give upward thrust into the stomach in a J motion.